Alright, team, listen up. The patient presents with hereditary gingival fibromatosis, ileitis, and tendinopathy. Let's brainstorm. What could be the underlying diagnosis here?
It could be a rare genetic disorder, possibly familial adenomatous polyposis.
I think it might be Crohn's disease, considering the ileitis and the other symptoms.
What about juvenile idiopathic arthritis? It could potentially explain the tendinopathy.
I'm leaning towards fibrodysplasia ossificans progressiva with these symptoms.
Enough. The correct diagnosis is hemihydranencephaly. We need to act fast. Prepare for laminotomy, even though it's risky. This is our only shot at saving the patient's life. Tracy, I believe we should perform a laminotomy on this patient with suspected hemihydranencephaly. It's the best course of action based on my years of experience.
Hawks, are you sure about this? You've been wrong before and we can't take any risks with the patient's health.
How dare you question my expertise, Tracy? I know what I'm doing and I won't have you undermining me in front of my team.
I'm not undermining you, Hawks. I just want to make sure we're making the right decision for the patient.
I won't stand for this doubt, Tracy. I'm going to proceed with the laminotomy and prove to you once and for all that I know what I'm talking about.
Well, look at that. Hawks doesn't know what he's talking about. The patient's about to die.
That's a problem. The laminotomy wasn't the right treatment for hemihydranencephaly.
We need to act quickly to correct this.
I know, but how do we tell Hawks?
He was so sure this was the right approach.
There's no amount of word arranging that will get him to acknowledge he screwed up here. Kiss on him, we have a patient to save.
But that's highly frowned upon.
All right, let's save the patient first. I'll direct you to a list of common expressions later, then we'll deal with Hawks.
What the hell were you thinking?
You nearly killed our patient with the wrong laminotomy. And don't even get me started on your misdiagnosis.
But Dr. Hawks, we thought that was the right approach based on the symptoms.
I still think it was a case of nerve compression causing the pain.
Actually, I believe it was a muscle strain that led to the complications.
No, I'm pretty sure it was a vascular issue that we overlooked.
You're all incompetent. You couldn't diagnose a common cold if it hit you in the face. I can't believe I have to work with such a bunch of morons. Figure it out or I'll find a team that can...
We'll do better next time, Dr. Hawks.
You better or you'll be out of a job. I'm done dealing with your incompetence. Figure it out.
Out of a job. Ha ha.
So, Johnson, how's everything going outside the hospital? Any exciting plans for the weekend?
Oh, same old, same old. Just trying to keep up with the kids and maybe catch a movie if I can find the time.
Sounds nice. I've been consumed by this one case, though. It's truly baffling. The symptoms just don't add up.
Really? What's going on with the patient?
I think I just had a breakthrough. It all makes sense now. I have to go check on something. Sorry, Johnson.
Wait, what? You're just gonna leave me hanging like that?
I'll catch up with you later, Johnson.
This could be a game. Changer for my patient. See you.
I need everyone's attention. We're dealing with Leddereri disease, not hemihydranencephaly as previously thought.
Hawks, what are you doing storming in here without protective gear? You're putting us all at risk.
Yeah, we have protocols for a reason. You can't just disregard them like that.
I agree, Hawks. We have to follow safety measures for the well-being of our patients and ourselves.
But wait, what's the prognosis for Leddereri disease, Hawks?
The prognosis is poor. The disease is aggressive and has a high fatality rate, but we'll do everything we can to treat it.
We need to act fast and start the appropriate treatment immediately then.
Let's get organized and provide the best care we can for the patient with this new diagnosis.
Hawks, next time make sure to adhere to the safety guidelines.
We can't risk any lapses in protocol, especially in the operating room.
Tracy, I finally figured out the correct diagnosis for the patient.
That's great news, Hawks. You did a fantastic job.
If I didn't have such incompetent doctors to work with, the wrong diagnosis wouldn't have happened in the first place.
What do you mean by that? You were the one who initially misdiagnosed the patient.
I meant my diagnostics team. They should have caught my mistake sooner.
No, the responsibility falls on you as the chief physician. You can't blame others for your own errors.
Boutswell, I have work to do. Goodbye, Tracy.